Hi everyone, my name is Lauren Cox and I'm a current third-year OBGYN resident here at VCU Health System. We will be talking today about a novel curriculum for PGY-1 OBGYN residents in regards to substance use disorder and how best to treat it. The motivation for me in particular for this project is that I have always felt a little bit lost when caring for our population that struggles with substance use and felt like I didn't know the best way to go about handling their treatment, both before surgeries or after or during labor. So it's affected pretty much every specialty that I have worked with. A little bit of background information. So amidst the current opioid crisis, residents in both surgical and primary care fields I think would benefit from intentionally designed education on opioid and other substance use disorders that go beyond opioid prescribing. While there are options for improving resident education on opioid prescribing, and these options are emerging, there's no consensus regarding how to best instruct these trainees in the additional key clinical skills related to opioid and other substance use disorders. The objectives for this study to assess the feasibility and acceptability of substance use disorder curriculum for OBGYN residents, as well as its effectiveness to improve substance use disorder clinical skills. Our methods, the design was a prospective cohort study. For our setting, we had a pilot 3-session curriculum developed based on the Council on Resident Education in Obstetrics and Gynecology, also known as CREOG. The objectives from there and adapted to substance use screening and substance use disorder treatment within obstetrics and gynecology. The curriculum included readings, didactics, and supervised outpatient clinical experiences. In regards to our participants, you can see here for figure 1, we had 12 residents. We had 6 residents from the 2018-2019 year and another 6 from the 2019 to 2020 year. So a total of 12 here that completed the first 3 know-how-to sessions and then a skills assessment form, both pre and post curriculum. And then down here for the learn to do sessions, we had a total of 4 residents, though we could have had 6, but due to COVID, 2 were excluded or unable to complete the rest of the curriculum. Here we had the residents rotating through an integrated OBGYN substance use disorder clinic, and they completed this curriculum. They completed a clinical skills self-assessment, which included substance use disorder screening, counseling, referring, and motivational interviewing. That you can see here in table 1. For kind of the assigned topics for the teaching, for 1 and 4, the clinical sessions, the topic substance use disorders, definitions and pathophysiology of it and the effects on pregnancy. For sessions 2 and 5, it's kind of the SBIRT, so screening, brief intervention, referral, treatment for substance use disorder. And in sessions 3 and 6, substance use disorder comorbidities, medical, psychiatric, psychosocial, and trauma history. For the know-how-to sessions, they were a little less in-depth compared to the learn to do, where usually there's more independence and not as in-depth as the other ones. Before and after the completion of the rotation, we used an adapted Swish rating scale over here that you can see for table 2. Here, the ranges are from 1 to 5. You can see for 1, it's show and tell, where someone feels comfortable only observing. 5 is the most comfortable, feeling like an expert that they can supervise others. And the questions range from, there's 4 different subsets, but the level of supervision needed for screening patients, and then the next in regards to the level of supervision for counseling them. and going down through supporting and guiding using motivational interviewing techniques. And then the last one, level of supervision needed for referring patients for specialty treatment for their substance use. These scores were compared between these time points using paired t-test. A subset of the residents completed the extended 6-session version of the curriculum, and these particular residents underwent a qualitative interview to assess the curriculum acceptability. Here for our results, you can see all PGY-1s, 12 out of 12 across the 2 academic years, completed the 3-session substance use disorder curriculum. Clinical skill self-assessments improved significantly in all areas. With respect to the resident interviews, we observed different themes, which included, as you can see here, the curriculum components contributing to skill improvement, insight into substance use disorder clinical skill self-assessment results, confidence in referring and treating these patients, and then barriers to improvements in substance use disorder clinical skills. The numbers over here and the number of times it was mentioned by the participants and how many residents mentioned it. I would say one of the largest barriers, which everyone kind of agreed on, was the lack of time and for opportunities to improve it, wanting more or higher volume and more practice in this area or these areas. For our conclusions, surgical specialty residents are an excellent clinical position to positively impact the opioid crisis, given their significant roles in both post-operative pain management for patients receiving medication for opioid use disorder and preoperative care planning in collaboration with addiction medicine providers. Additionally, residents are exposed frequently to the complexities that surround inpatient care of people with substance use disorder. Such a multidisciplinary and multimodal approach could better prepare residents to independently care for this unique patient population with complex medical and biopsychosocial needs. Overall, more research with larger sample sizes is urgently needed in order to identify how to best provide proper education and training in substance use disorder treatment for OBGYN residents and support residency program leadership in doing so. Thank you for your time, and if you have any questions or concerns, please feel free to email me. You can find the email up here. And that is all. Have a great day.